Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Hello, I'm the educational consultant with Advanced Nurses at ACD4N, and today we have Mitch Mitchell with Mitch Mitchell Consulting.
I started as a biller back in 1983, started as inpatient, switched to outpatient, learned that, did registration supervising in the emergency room during the same period of time, and I learned how to do everything else. I've mainly worked in hospitals. I've done a little bit of work in a federally qualified health center. I also worked for a physician's billing company, which was interesting because that is what prompted me to learn charge master work. But I found that it was interesting that a lot of the hospitals I have gone to as an independent consultant didn't have anyone running their charge master. So that's scary, but it's not unexpected. Anyway, I did a lot of that work until 2001 when I decided to go out on my own. And I've been a consultant ever since.
What's your opinion about the future for healthcare professionals, and what do you think are some skills that are going to be more in demand for individuals who want to continue to work in healthcare?
I'm going to start by mentioning this two-letter thing that bothers me, AI.
Mm-hmm.
There's a lot more hospitals across the country who are looking to set up their computer systems to have AI handle almost everything so that they can not have billing departments per se, because it costs a lot more, the way they see it, to pay for the employees, to pay them their salary, health benefits, everything else. We can just have AI do it. And right there, you're already seeing that there's going to be a problem, because if some of the people who are doing that work don't understand all facets of it already, then how's AI going to take care of that? And insurance companies are doing the same thing. So basically you end up with AI talking to AI, and who's left within the facility who's going to step forward and say, okay, I will investigate this further, or maybe I can help give some answers. You're going to need a computer programmer to know it as much. The same thing goes for, medical records. I certainly hope it doesn't do it as much in the clinical areas, but how do I know it's not going to happen? It talks about different coding, procedure coding, for instance. So you've got something set up where maybe AI takes care of that. But how do we know that AI is going to get everything that's needed? That's one of the things that made me valuable at the hospitals, is that I met with every department director multiple times. Even as a consultant, I would meet with these directors because I would see things, I would ask them about things, and sometimes I knew that you need more than just one thing on there in order to get an insurance company to pay for it. I mean, that's just how that works. There was a question, or not a question, but it was something I talked with medical records people about, where I sometimes said, sometimes you need to add codes to, give it a little bit more gravitas as to how come this turns out to be so important for this patient to get paid. And if it's an inpatient claim, to get that DRG rate up, you need to say more. That is very important, So that's one of those kind of things where I'm really worried, because in my opinion, anyone who thinks that AI is going to be more important than having real people there, who's gonna monitor it? Who's gonna take care of it? So I think that's a problem. And that's at a different level than what I would do probably and what you would do, but it's still important, because AI is not going to solve all of those problems. I think that there needs to be more critical thought and education on what everybody does. I'll use this as another interesting example. My ex worked in healthcare also. She worked in, I can't remember what department she worked in, but what happened is that they got a new supervisor for the department, but the supervisor they got was already over 2 other departments. And it turned out that she only knew how the one department worked. So she didn't know how the other 2 departments worked. So when they would go to ask her certain things, she didn't know how to answer. So she just said, well, you guys know how it works, so do what you need to do. Well, no, that's bad. That's bad leadership. So how do you know that anything's going right? You don't. And the people who should know how that works are the people who the supervisors report to. And if they don't know what's going on, you can't, it's not going to work. Mm-mm. That's the problem I see. And I understand, people are busy with a whole lot of different things, but that doesn't mean you can't learn something all the time. Yes, I ended up in 2 different hospitals where they were in financial trouble, and I had to, work some miracles fairly quickly. But if I didn't teach people how to do things at the time, then I would have just put the Band-Aid on something without actually improving things. That's a big issue. The future as a healthcare professional, I will say that I have some hopes that maybe there are some hospitals. I know there's some hospitals who are probably doing everything the right way, but I also know that it's getting harder. A lot of smaller hospitals are having to close, which means that there's really no one left in some communities to take care of things that the big hospital can do, but they're overwhelmed with people already. So, that's the whole thing. There's got to be more thought about the patients and the employees that will help everybody, because it's getting scary. I think that what have we had? At least 20%, 25% of hospitals that have closed in the last 5 years. That's just wrong.
Wow. And as you could imagine, who's impacted the most when you have hospitals closing. And you think about how this impacts public perception about healthcare, and how this nation prioritizes healthcare. When you can have hospitals closing, you think to yourself, well, if we could have innovation happening in at Google and all these major companies, you think to yourself, well, why don't we have the intuition and innovative thinking to keep these hospitals open when we know that they're serving the public? We know that this is about keeping people healthy and well, which should be, you would think healthcare would be the most important thing. When you think about things like Maslow hierarchy of needs, you're thinking, okay, hospitals definitely have to be number 1 on the list. And as you may know, as I know too, working in healthcare, healthcare is it's just like one other thing. It's like going to a fast food restaurant. It's just like one other thing. It's not a priority at all. So I did want you to share with me about Mitchell Consulting, and exactly what your services are and how people can get in contact with you.
Well, first, once again, thank you. My company is called TT Mitchell Consulting Incorporated. I've got a website where I talk about, basically, I handle a lot of financial things: charge master, revenue cycle, admissions. I've done all of those jobs. I can go in and do that. I can do audits of different departments as it works. I wouldn't want to do the clinical areas because I don't have full expertise in that area. I would just be going in kind of like the relative of someone, seeing bad things and saying, hey, y'all need to fix that. But that's not really, an area that I can even offer any kind of suggestion in. I also have done leadership presentations and diversity presentations. I've spoken in 7 states, and I enjoy that. I haven't done it for a while because I had other obligations, but I've at least spoken in other places. I've spoken here often. I've spoken to, nursing, people, because that's a group that I had. I gave a seminar on why certain facilities need to have more training for both minorities and females in healthcare leadership positions, succession plans, because that's what the world is, and that's to be fair. And it changes the perspective if you see that people who you might not necessarily be thinking of for these positions have the skills to do that, but sometimes they could use some training on how to get there. And if you're a good leader, you're going to know how to help train them. Even if all you do is you sit with a committee and, come up with the things that you hope that someone is going to teach them so they can be good leaders. But without that, in every position I got, nobody ever had any real idea of what kind of leader I was going to be, because they didn't know how to ask the questions. So, I'm glad I got those positions, and I think they were happy that they had me for at least the time that I was there. But without that, I have a high wish. And I can say that because I'm older. If I was in my mid 40s or whatever, I might not necessarily say that, but I'm older now. And it's one of those kind of things where that's just a reality. And I wish there would be a lot better change, a lot better information. And it's not just hospitals, it's nursing homes, but it's also people who are in a position where they oversee healthcare, but through a government, working with the government. I mean, I live in New York, and during the pandemic, the governor at the time, Governor Cuomo, decided that they were going to have hospitals sending people with COVID to nursing homes across the state. Well, that was a bad idea. I knew it was a bad idea the day I heard it. You're going to send people to nursing homes that are already way understaffed, that already have most of those people who are working those, nursing homes aren't qualified to handle any of the medical stuff. And they are the most, vulnerable patients in a nursing home. That's the best idea you have? I'm sorry. That was one that the nursing homes didn't have any choice. They had to let those people in. But I don't think that I read anything from any hospitals where a leader of those hospitals were saying that's a bad idea. I wrote about it on a blog post, but no one was reading that. It's stuff like that where you need someone who is, I'll say a healthcare finance consultant, someone who can get away with saying something that maybe a hospital is a little scared to risk because maybe they're getting certain benefits from the government. I don't know. That's one of those things. I would love to do that, mainly on the financial end, but I would love to do that because I know, I'm not going to say that I know everything that someone else doesn't know, but I have thought about all those things and I know a lot. And I've written about healthcare for a long time, healthcare finance issues. And I know that every hospital I've ever consulted at and every hospital I ever worked at, when I left, they were generating more income and people were trained better. That's my history.
Well, thank you. I appreciate it. I'll just share this. I found you and your content on YouTube. You have a great YouTube channel. I will be sharing a link to your YouTube channel in the description of this video. I found you actually because I was actually looking for someone to kind of explain what revenue cycle was and revenue management. And this was like early on when I was in my own like self-discovery of what I wanted to do in healthcare. And so I'm like, oh my God, there's this Black man speaking so intelligently, and he's just going into all this detail about revenue. And I'm just like, and then you start talking about like diversity and you start talking about leadership, and it was just hitting home for me because, again, not really seeing people that look like myself, and you kind of represented in a lot of those roles that we see within hospitals and other healthcare institutions. So for me, just to see you, like, not only just talking about it, but also having the lived experience working in healthcare from that perspective, I was like, oh wow. So continue doing your work. I will be again sharing a link to your YouTube channel, your website. And are you still writing?
Oh, yes. I haven't written about healthcare as much as I was. I've been writing more about different leadership, diversity, and ethics. But I do slip in something about healthcare every once in a while. I was thinking about something earlier this week that I may still get to. I had to finish on a different topic. I think I shared that with you, and I pasted it on LinkedIn. That I thought was important because of the time period. But yeah, it's time, And by the way, just to say this, on the blog, when I've written about healthcare, I have never worried that someone was going to be offended by what I said, because I doubted that anybody was really going to read what I've written and say he's wrong. If they did, then that would prove they just don't know their departments.
Well, so I hope to have you back sharing more about your experience working in healthcare, sharing more about revenue. I would really like to have you back to actually talk about revenue cycle, revenue management, and what that's like. You talked about some of it today, but I would probably really like to have you back to kind of go into that a little bit more, because again, one of the focuses for my channel and also for my consultant service is to educate nurses about other areas of healthcare. So I think you'd be a great resource, and I definitely want to make sure that I share your information so that nurses who are interested in revenue management and revenue cycle, they know that they have someone they can reach out to and consult as far as like, if this is a pathway in healthcare that they want to go into, that they can reach out to you and learn about more about your services. So thank you so much for your time, and I wish you the very best.
Thank you. I'm glad to have had the opportunity to talk.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites, www.advancednurses.info or www.acd4n.com.